Co.
Start.
Hey.
Con.
Ver. Sex.
Shun.
All right, welcome back, everyone. Last time we did our first informal episode of the Let's Conversation podcast, where we just vibed, played some games, and had a great time just socializing with one another. Hope we were good entertainment for y'all. And now we are back with episode 6, and we'll be talking about mental health in APIDA families and its impact in general during the COVID-19 pandemic. Well, I'll introduce myself. My name is Kang Fan, and I am the Indiana CoStaRt, and I use he, him, his pronouns. I'm an alum from VSA-IU, but I'm now currently at the Indiana University School of Medicine, where I'm literally studying 24/7.
Yikes. Hopefully you're getting that rest there, because this is all it's about in this episode.
Really.
All right, well, just to segue that in, hello everyone, welcome back to our episode 6. Hope you all have been a great time. As foremost, my name is David Tran. I use he, him pronouns. I am the Michigan CoSR or state rep, and currently it's midterm season, so it hasn't been too bad. Just being able to kind of take care of myself, but I recently just got back from Chicago to visit Maya, our Illinois CoSR. So apparently there's a big height discrepancy. So if you ever meet me in person, it's kind of crazy. Apparently, I don't think I'm tall, but some people think I'm really tall. So I know Molly, I met you like 2 weekends ago. So I'm pretty sure you had noticed that big height discrepancy.
Oh yeah, you're definitely tall. There's no way that you're getting around that. And with that, I'm Molly. My name is Molly Rathwong, and I'm the Ohio CoStar. I use the pronoun she, her, and I'm also an alum of the Ohio State University. And really, I just been chilling. The weather here has been really weird. It's been hot and cold, so I don't really know if it's fall time to really enjoy fall activities. So we're just going with whatever the weather is right now.
I think if I recall, last time you talked about the Mercury retrograde, so maybe that's been affecting everyone's vibes,
Maybe.
So, but yeah, so just to recap for everyone that's new or maybe returning, we started this podcast in order to create a safe space for us to talk about life, school, community, identity, and pretty much everything in between. We wanted to use this platform as a way for us to empower each other's narratives and destigmatize what it means to be a Vietnamese, Asian American, or just a person going through life. So hopefully you all can resonate with our stories and just honestly vibe with us. And then for the trigger warnings, that we do have in here is that anything that is said during our podcast are the views and experience of our own individual selves, and they do not reflect UVSA-Midwest at all. So topics discussed in our podcast may be personal and or sensitive to some individuals. And some of the trigger warnings that we may be experiencing during this podcast will be trauma, self-harm, suicide, anxiety, depression, racism, and discrimination. But I'll hand it back to our host, Kang, to speak for the rest.
All right, thanks, David. Also, to reiterate, you are tall. I'm pretty sure you're the tallest CoStar in our cohort. All right, like I said before, episode 6, we'll be talking a lot about mental health care in relation to the COVID-19 pandemic, as well as its impact on APIDA families, the general feelings about it in the APIDA community, family expectations, and similar themes that can be found in other communities. So with that, we'll get started and talk about mental health during the COVID-19 pandemic, and especially, becoming a really important topic since March of 2020, whenever the COVID-19 pandemic first arose around the world, due to the effects of social distancing, quarantining, and then just the societal issues that were brought to light among a plethora of personal struggles that individuals experienced in the last year and a half, whether that's losing a job, losing a loved one, or just anything that people have been struggling with. Mental health has definitely been a huge key issue within the COVID-19 pandemic. According to the National Health Institute survey conducted by the Center for Disease Control, it saw that 41% of adults actually suffered symptoms of anxiety or major depressive disorder during 2020, basically the year of COVID, compared to just 11% in 2019. And this really impacts our age group between 18 and 24 even more, as out of adults that had these symptoms of anxiety or major depressive disorder, 55% of them were in our age group. And some of the reasons for these trends can easily stem from the effects of COVID-19 as the job market took a big dip with employment skyrocketing and financial security being tested. I know I wasn't sure if my dad was able to hold on to his job. So I definitely tested my mental health a little bit. On top of the societal effects of quarantine, of social distancing that COVID brought upon. And yeah, these effects also have been disproportionately affecting minority communities. For example, symptoms of depression were reported in 40% of Hispanic adults compared to 25% of white non-Hispanic adults, according to the CDC. And then finally, a poll by the Minority Consult revealed that American minority groups, including LGBTQ+, Asian, Hispanic, Black, and Native American communities all had 40 to 48% of adults experiencing more trouble with their mental health during the pandemic. That's pretty much, 1 out of every 2 people, like basically half of the minority population was mental health.
I'm just taking this all in. I Molly and I are just kind of struck right now. I think, so, I just want to talk about the statistics real quickly, is because, 55% for ages 18 to 24 is a very big statistic. And I think, what you really just I want to think about right now is that the fact that we see there's an increase in the percentage of adults going through mental health versus before COVID, substantial. And it's a lot because it shows how much a global health pandemic can do to individuals. I remember when to talk about COVID is that when it first hit in March, everyone was at first it's just the flu, it's gonna go away, things like that, all of those jibber jabbers. And it went to the point where people were oh, this is getting kind of serious. People are starting to go to hospitals and ICUs. And that's when people started having this world of panic. And I think from there, it kind of just really set everyone off put. Even I was set off put. And as a university student, it really kind of was confusing because, for us, I'm pretty sure most of us were seniors or juniors during this time for this cohort. But, being kicked out of school is kind of I guess the greatest thing to happen to us. We're oh, no school. But I think thinking about it backwards, I'm just wow, we got kicked out of school. How bad can this be,
Yeah, I definitely agree with all you said, David. And just to add on, I remember people think COVID-19, and obviously it's a physical thing about people getting the illness and being sick and having these physical symptoms. But one thing that really flies under the radar is mental effects that COVID-19 and the whole pandemic has had. And it doesn't have to stem just directly from COVID, whether that's you losing a loved one or suffering from the condition, losing or having a deteriorating mental health per se, but the effects of social distancing, not seeing your friends in quarantine, all of that pretty much has made mental health a really important issue and something that really hasn't been talked about too much during the COVID-19 pandemic, because we think, COVID-19, I'm not gonna get sick. It's just basically the flu, but we don't think about the mental health implications that it can bring upon that can really affect, and I think it has affected everyone in the globe, honestly.
No, absolutely. And yes, Molly, I see your hand. What's up?
Yeah, no, I was just gonna say, yeah, I just have to echo that because everybody just thinks that just because COVID-19 is a thing, it doesn't affect other people who, how do I say, in the society and stuff like that. And I can for sure say to myself because even now I'm I don't know, I'm a very extroverted person and stuff like that, but then during this pandemic I became a little more introverted and more of a homebody, and now that I air quotes am able to go outside and interact with people and stuff like that, now I'm just still is this okay? Am I allowed to do this? And I mean, I am still very extroverted, that hasn't really much changed, but now I'm a little shy when it comes to meeting people and meeting new people as well. It's hard for me. And that's like funny to think that like me as an extroverted person, like that would affect me too. And just like trying to put that perspective into like a more like global sense, like how it's gonna affect other people and how they may interact with like new people or people they've been interacting with before.
Yeah, no, Molly, I think you touched on like a very great point too, is because, this isn't only just like a United States issue or like things like just for us, but it's for everybody. Like everybody's going through it. Like I remember when like my family members from Vietnam were just talking to like my parents over the phone. They were just like, have you guys been hit with COVID? Like it's been hitting us pretty badly, or like things like that. And so like knowing that like someone from like, across the country is able to also be bearing witness to this, it's an issue. And I think actually this really transitions to like a really great point that I want to bring up is like, we talk about like the cause and the effects of this, but let's think about the after effects. And like, what I mean by that is like the normalcy of this, like, like trying to go back into like this period of like normal, right? Because a whole year has passed now, y'all. And quite frankly, COVID is still here. It's still alive. Like the third booster shot is still like out here and like it's starting to like be more relevant. But I feel like I've noticed that a lot of people are trying to get into like this whole habit of like, let's go back to normal. And I think for me, it's thinking about like, well, what is normal, especially when it comes to mental health, right? For me personally, I want to say that like before COVID, I would say that like I was disregarding my mental health extremely. I think most people can kind of relate to this, but like, you ever have like that feeling when like you kind of like to keep yourself busy and like you have like a back-to-back schedule and such forth. And that is kind of just like a way for you to kind of hide the fact that like something's going on with you, like internally. For me, I used to like for VSA specifically, I used to like always take up all these positions and also like all these projects. And it came to the point where I kind of like burnt myself out really badly, and to the point where like I would dread going to VSA events and just kind of like have no energy whatsoever. And also with my family issues too, like during COVID, like it's an economic thing as being a family of small business owners. There's a lot of cutbacks that we had to do. We had to sell some things, we had to cut back on some costs. So it's already a lot of stress going on. And during COVID, it wasn't much difference. It was like pretty much the whole world decided to take like a big pause. Like when you pause on Netflix, it's just like it stops, and then like the world is asking you, are you still there? Are you still watching? So I kind of felt like that. It was like, I don't know, like, should I be continuing? And then the minute I press that continue, right, I only press that like pause and unpause button in my mental head is because throughout COVID, I self-reflected a lot because I didn't have things blocking my like field of vision. So all I had was like myself and my thoughts, and then like an empty room that like I was just kind of like stuck in for a while. And so, going out of COVID, I was able to kind of think about self-care a lot more specifically about knowing my own limitations, knowing my boundaries, but also kind of taking time for myself, like I think for me, Google Calendar is like my Lord and Savior. Sometimes I would say my bread and butter, and I follow it to like a T. However, I always make buffer time now to like allot like myself an hour or two just for myself to kind of decompress and also take time to eat food. Honestly, I did not eat that much before COVID, but now I make time for myself to eat because if I know if I don't eat, it's gonna affect me long-term wise. So that's just, my little tangent real quickly, but I guess a question I have for both of you, because we're all in a sense still students and young adults, is that like when we're going back into like this, quote unquote normal period, like what changed with like your self-care procedures, your mental health? Like, was there a positive impact, or was it still kind of something you're still learning?
I can add on to what David said. But yeah, David, I definitely like, it's always obviously like, I'm trying to think, really, I guess, welcoming to see that, you came out of COVID, honestly, an improved guy, bringing back mental health into the picture and making that a better pillar about yourself. And then you said like making a schedule eating. So that was a good idea. I also definitely agree with burnout. I remember my experiences with some friends playing events and stuff like that. I could tell that they were starting to get burnt out with, due to multiple factors. I remember like we were just around, I don't know, bunch of people were like dreading going to e-board meetings just because like they just didn't have time or didn't really want to go. And I think a lot of factors that stem from the pandemic, whether that's not having people show up because of lack of interest, maybe due to their poor mental health, the stress of school and life in general, of social distancing, quarantining, or the like unpredictableness of COVID-19. So yeah, burnout was definitely a big thing for my friends and potentially for me too. But to answer your question, sorry, David. But to answer your question, before COVID, I was really fortunate to not have any times where I struggled with my mental health. There'd be times, obviously, where I'd have some anxiety with, school deadlines to meet, just stress with, life events, but nothing that extremely crippled me or like made me pause and self-reflect with myself. But the pandemic really tested me at not having that in-person interaction that I honestly took for granted when COVID started. That was really hard for me just because, not seeing someone in person and like Molly, me being an extrovert, it was definitely hard for me to like not have that anymore. Applying to schools because between my junior and senior year, I was applying to med schools and, taking tests for them. That was huge stress on top of, COVID-19 of the summer. That was hell, pardon my language. And, the societal issues in the nation, including just racism and discrimination against BIPOC communities that, affected all of us. I definitely, try to maintain my usual self-care routines of, exercise and trying to socialize with others to maintain those relationships and distress from whatever's going on with life. But, it's hard to go exercise when gyms are closed and quarantine was a thing. I remember to supplement that, my roommate and I, we filled up a duffel bag with like textbooks and we used them as free weights. I will say though, David.
Very interesting. I like that.
Oh yeah, it was funny because like we could like adjust our weight just by like adding on or taking out of some textbooks. But yeah, adding on, David, what you said, like you were eating more. I definitely did a lot more cardio because there's not much variety you can do with just one duffel bag. So I try to do a little more cardio. So yeah. Nowadays, I hold my mental health as a major pillar and keep it well. With lots of self-care techniques that I actually never tried before COVID started. I've been high into meditation. I try to meditate at least once every other night right before I go to bed, just to de-stress from the day and just go calmly to bed. Yoga, it's something that I actually never done, but it's really, really calming. And the IUSM, the Health Coalition here, they offer yoga weekly on Thursdays, and I try to go every week just because it's a really cool experience. And trying new exercises, like I said about running more often, I've been trying a lot more new exercises to keep me engaged and just keeping things fresh and making my mind stimulating with all these workouts and just getting my mental health in check. Yeah.
King, are you a fan of hiking?
I love to hike. My concern is I'm a really clean guy, so I don't know. I like to hike, but very end, I have to go take a shower immediately just because I just hate feeling really, really dirty. I don't know. I do like the the exercise, I guess, that you get from hiking. But yeah.
I think you should just rough it up and just shower with the rain is what I say.
Wait, I'm curious. Where do you like do yoga? Because or meditation, stuff like that. Because I've also been interested in it, but I never knew to where to start.
Yeah. Well, meditation. So IUSM, they offer a free subscription to all students. It's through Headspace. It's an app. Unfortunately, you have to pay for it, but the method is pretty easy and simple. It's just they tell you how to check your breathing and just as an example, they have you close your eyes, check your breathing real fast, and then just make your head feel heavy and just de-stress from the day. Try to get yourself out of your physical body, if that makes sense, and just be in touch with your inner zen, if that makes sense. Yoga, they offer outside with winter coming. I'm not sure how that's going to happen, but they offer it outside outside of a dormitory hall, I think, on campus. And they do offer on Zoom. So we have a few regional campuses, and people that want to do yoga, they can just go on Zoom and do yoga with us. But yeah.
I think if you want the free version, you go on YouTube and buy yourself a
I would
yoga
say
mat,
that.
Molly. I personally also have a yoga mat in my closet right now. And like, I would say like the best time is kind of like in the morning when you're just getting up and kind of like getting ready for the day. It's like you just kind of like, just stretch out. Like I do like that one pose where you stretch out really far and it's just like, oh,
Mhm.
what's it called? That's crazy. But yeah, I mean, Molly, so we heard about myself and Kang's. Do you have anything to input for this?
Yeah. So basically TLDR, before COVID, my mental health was garbage. And now or during and after like COVID, I use air quotes again because like we're not done with the pandemic, I believe. But it's so garbage, but I learned how to manage it a little bit better. Before COVID, I tried to get into like counseling and stuff like that during school, but I just was not able to. There was a lot of like failed attempts essentially. Like I would go and reach out to someone and be like, I don't feel so great about myself, and they'll just like turn me around. And it's kind of like a blessing, but also not at the same time because I actually got into counseling during COVID, or excuse me, during like the beginning of the pandemic, so around like May 2020. And so I was obviously happy that I finally was able to get into counseling, but like, why did it literally take me until my 4th year of college to get me into this? And like, I don't know, I felt happy that I was able to like eventually like, you know, air quotes use or air quotes to start my journey on like my getting better with my mental health and stuff like that. But it was just like, bro, why did it take so long? Um, but I'm so glad that I did start counseling during the beginning, like of the pandemic, because I had a lot on my plate. Like, not gonna lie, I had a babysit for my aunt who worked as a nurse on top of school because school was still going, and then I also had summer classes that semester as well. And I was also vice president of UVSA, and my school is AAA, which is Asian Student Association. And then I was also part of like this, I don't want to call it task force, but essentially it was like that, where it was like me and a couple other peers who were part of organizations and stuff like that. And then also staff from OSU. And we just wanted to like, we noticed that a lot of students on campus or are on campus because it's the beginning of the pandemic, they started like telling people to like leave campus and stuff like that. But we started noticing that people have been witnessing like an increase of like racism and stuff like that, specifically towards like, the Asian community and stuff like that. And essentially like this group got together to find ways on how could we combat that, and like how could we host forums or like be some sort of support system. And unfortunately, it never became a thing. I was really excited for it because it was something like really cool and like something I really like channeled a lot of my energy towards, but it never happened. But that's okay. I still use resources from that. And so with all of that, I was also dealing with the loss of a friend. I also lost a friend during COVID. I don't know. I was just going through a lot. So thankful for the counseling that I got at that time. And it was like interesting because in like Lao culture, like I don't know if this would apply for anyone else, but I know that a lot of like people from the community get together and like help like prep for the funeral and stuff like that, and help the family like the few days after the funeral and stuff like that. But it was like interesting to see that I wasn't able to see like people from my community because like for me the Lao community is very tight knit, and like a lot of them are my grandparents' friends who also in a way like kind of raised me and stuff like that. So I was just going through a lot, and I was just like seeing my counselor like talking about anything and everything I could within an hour for the 2 weeks, every 2 weeks that I could. And honestly, like I said earlier, like it was like a blessing, but also not that I didn't get into counseling, but until like my 4th year. But I'm glad I had my counselor for that, time period. And so with counseling and, just like trying to enrich myself, I've learned to really just enjoy my life and take things slow because of all the things that I like went through this like pandemic and stuff like that. I realized that like I'm young. Like I know it's like funny to think about that like we're all around like the early 20s, so we still got a long way to go. And I shouldn't rush myself. And y'all too, y'all should take this advice too. I really learned this. So like I always been that way to like enjoy life and stuff like that, but I really like instilled it into myself to like really just take things slow and not rush myself to get anywhere, because like that saying goes, YOLO, you only live once. You really do. And also just be patient with yourself. You'll get where you need to be.
Yeah, no, I definitely agree with that. Just because I don't know, med school is like a lot. Like this semester has been like studying, and then at night more studying. So like trying to live my life a little more and like make that balance work has been like, you know, a struggle. But slowly I think been doing a decent job of, you know, like you said, YOLOing it. But yeah, yeah. For that, we're gonna go in right into halftime. So yeah. With that being said, we're going to transition into halftime. When we come back, we'll go more in depth about the impact of mental health in APIDA families. But right now, we're going to go hydrate, do whatever we need to do, and get back from halftime. See y'all soon.
Hey y'all, welcome back to the second half of episode 6, everyone. Hope y'all had some time to think about mental health and its importance I can talk during the COVID-19 pandemic. Now we're going to transition into its impact in the APIDA families.
Yes, hello. Also, I'm just wiggling my arms around, just, you know, flex, kind of like, you know, get myself kind of, you know, you gotta like loosen up your joints sometimes, you know. I sit in like this like seat for so long during school that like I don't get time to like move up. But yes, mental health in APIDA families. I think this is something that we can all relate to, or if not, our listeners can at least relate to as well. That, you know, I think, now picture this, right? I want you guys to all imagine this right now. You know, you got close your eyes, close your eyes. You just need to listen real quickly. You know, picture this. You're going through school. It's midterm season, which is kind of right now. So reality check real fast. It's midterm season. You're struggling. You've been up since like 4 a.m. and you are like crashing down. And the next thing you know, the next day you hear your family members call you and they ask you, how are you doing? And then you tell them that you're not doing okay. And what's the response that you would think they would say is, are you okay? But no, the other responses you get is, no, get over it. You'll be fine. Now wake up, y'all. This is the reality that we live in. Unfortunately enough, most APIDA families have a very cultural indifference to things, and that is to kind of not submit to defeat. And a lot of it has to go with the whole idea that, like, you know, Asian Americans, for us, we have been into an environment where we understand that mental health is important and like it's okay to not be okay. However, for folks that are coming from Asia, you know, the whole cultural environment and impact over there is that, you know, you have to be the best, you have to do everything perfectly, and there's no room for error. So, you know, coming with that environment and mind spec and bringing that over when immigrating, to us, that is something that is, you know, morally different from what we believe in, you know, because for us, we believe in making sure we're okay, taking care of ourselves, and saying that it's okay to not do it correctly. But for our parents or for our grandparents, you know, they don't believe in that stuff. They kind of, you know, for some people, like for what my dad always says to me, which is kind of like annoying, is he'd be like, oh, that's all bullshit. And like, pardon my French, but like, that's pretty much what it is. You know, they think that that's how it is. But then, you know, you have this argument with them and like, it's almost really taxing to like kind of think about it, you know. And, you know, like there's a lot of factors into this. There's families' expectations. There's a lot of the model minority myth that we get from society, thinking that Asian Americans themselves are actually pretty well up there. Like they're very adaptable and also like know their stuff. But really there's more to it than meets the eye. And like, you know, with that in mind, you know, after you waking up from your nightmare of like thing, what do you guys have thoughts about that? Like, does that relate to you or?
Yeah, no. Like you said, like mental health is definitely seen as a weakness / taboo in APIDA families. I know a friend of mine, he recently got into a car accident and he was immobilized for a very, very long time, like months, honestly. And I know like some statistics about how immobilization, not being able to walk, not feeling like you're being like contribution to your family or whatnot is like kind of taxing on your mental health, especially leading to potential depression. I knew like the stats about that, but I was talking with my friend and his mom about it, and I was just talking to them, be like, hey, just making sure like you're feeling fine, whatnot, and like all that stuff. And they've like felt like they were fine, and like I brought up, make sure that you're fine, just make sure like you weren't having any signs of depression, and they pretty much just ignored it, thought I'm not gonna be depressed, don't worry about it. And like I trust them to make sure I think like they're not depressed and like not going through these depressions, just because I know that it's a really big issue, immobilized patients, but potentially having that seen, or having mental health seen as a weakness or taboo, could potentially be a factor of why they didn't want to talk about their depression at the time when I was talking to them. But yeah.
No, you're onto something really, because right now, so I'm going to read this article that well, thank you so much for bringing this up, Kings, but like the Western Journal of Medicine, or also known as WestJM, or Med, sorry, words. This is actually a journal that was made by a couple of Asian American and also Asian, journalists. And some of the big points I think you want to bring up that you actually are talking about is like the level of acculturation. And what I mean by that is that, in this journal that they specify, they talk about for Asian Americans, it takes approximately about 3 generations. So for most of us, I'm first generation. So it'd probably be like my grandkids that would be fully able to adopt the lifestyle of like the dominant culture that is currently in place. So in this case, we're in America. So it would take until like my grandkids to be fully like Americanized, if that makes sense. With that though, it shows a lot of like intergenerational trauma that we have, because, for folks that may be immigrants, first generation, second generation, or third generation, there's a lot of differences in what we face. For myself specifically, first generations mainly have this trauma of facing what immigrant families' expectations are and trying to upholding that, while also at the same time trying to adapt into a world that like they are profoundly new to, so they don't know what's going on. And so there's a clash of cultures in that sense. And I would say personally too is that, immigration, like I've mentioned it a lot, but there's a lot of things when it comes to immigration that I feel that like, for me personally, a lot of like my grandparents and also like my ancestors would kind of say that like, oh, because you immigrated, you need to be very appreciative of like all we've done for you. And so like your mental health is like a back burner at this rate. Like this isn't priority. Your priority is to live a fulfilled life so that way we can be happy. That's a lot of pressure. You know what I mean, y'all? Like, I don't know if you all felt that pressure before.
Yeah, no, I definitely agree. Going back to what you said about clash of like, there's always times where I clash with my parents about the cultures between having our Vietnamese roots clash with our American identities. And like, I always say like, for example, my mom always is like, make sure you address me saying yeah, instead of, like, yeah, or what's up, like, way. And she says just to do it just because trying to stay true to our Vietnamese customs and Vietnamese culture. And whenever I was young, like in high school, I would have been like, wait, why do we have to do that? We literally live in America. We should go with American customs. So that clash of like cultures is always there with APIDA families and just BIPOC communities. And yeah, talking about like family expectations. Like I know it's definitely a struggle and to live up to family expectations, whether they're high or low, especially with APIDA families, that the minority myth is a big thing. And just, trying to process the family expectations that they explicitly and implicitly put upon you is always something to struggle with, but yeah.
Yes, absolutely. So I think it's just like it's like a family thing, and like that's the big thing too. It's like when you're with a family is supposed to top everything, and then like from there it kind of blindly like makes you not aware of like the other things that are going on in your life, which is also self-care, mental health. So as much as family is important, I do love my family, it sometimes will blind me to the things that I'm not doing, and that some of those things are just taking care of myself.
Yeah, for sure. I can also relate to that because I also struggle with that that issue of just trying to juggle like being there for myself, but also trying to be there for family. Speaking of which, there's actually a term for that. Well, not really, but like I like to say that there is a term for that. It's called filial debt. Um, and the Google definition, or it's actually from the balance, but it's the filial responsibility is a legal term for the duty owed by an adult child to their parents for the parents' life necessities. It's commonly an issue when a parent is in need of long-term health care but isn't able to pay for it. So I know that this definition that I found from the balance is more so talking about like health and taking care of your parents and your family members when they're older, when they can't, take care of themselves and stuff like that, which is a issue and not an issue, but something we do see that does happen within, a lot of our families and not just our community and stuff like that. But I feel like that does not also just define that. It can cover a lot of things. For example, like we talked about earlier about how our parents and our family members always tells us about how since a lot of I'm assuming all our parents are here are refugees or some sort of like that, they immigrated from a different country and are here, and they like to tell us about how immigrating to the United States was very hard, which I'm not trying to knock on their trauma and what they went through and stuff like that, but because immigrating here was so hard and what they went through was a lot, which is very true. I'm not saying that it's not a lot, but then they like to some families, not saying all, would like to tell people of our peers and stuff like that, our age, that because they went through so much to bring us here to the United States that we should feel grateful that they went through all that, and anything that they do for us, we should be appreciative of it, and we should be better and treat them, how do I say, like spoil them when we get these big jobs from going to college and stuff like that. And as much as we all of us would love to do that for our family and spoil our family for being there for us, like it's hard to when you have to be there for yourself, but then also be pressured to spoil our family members and stuff like that. So it's hard.
No, and I think it is like I think like it's almost kind of like reminds me of like guilt tripping, it's almost like you'll do something for me and like in return you'll do something for like me in the future. So I think like I think it is very, very crucial to like recognize that, because I think what you said is all valid points. Like you aren't invalidating anyone's like experience. I think all their experience are definitely valid, especially for our parents, for some of us. Their journey and their experience getting here is definitely like very hard, and like we understand that. However, I think as we come into like an older age, as we become like younger adults, is that there needs to be a compromise between our parents and also ourselves. Moreover, so like I think it's just kind of like having that open dialogue and kind of letting them know that like I see you, I hear you. However, I also need to be here for myself and hear myself at the same time. And I think like just to kind of real quickly add on is like sometimes I think it takes something to happen in order for our parents to understand. Unfortunately for me, I will speak on my experience that my mental health wasn't really fully recognized by my parents until I landed in the hospital. So, having malnutrition and a lot of stress, I ended up going to the hospital, and it wasn't until my parents saw me on a hospital bed that they started to realize that they're putting a lot on me. And, I think you mentioned it earlier, I'm not for sure, but like you said, being the oldest has a lot of expectations, and it's really struggling because as the oldest, you have a lot on your plate as like being the caregiver and also really just being like that person that is like doing everything, like especially if you have a family of refugees. So it's very taxing, but it's really hard to also like kind of vocalize how you're feeling, because you don't want them to feel that like you're being a burden, because then they're gonna be like, well, like I'm depending on you. And it's like at that point you're just like, oh, well, they're depending on me, so I should just be fine. But like, if you're not fine, then be vocal about it.
Yeah.
Go ahead.
Sorry.
Mhm.
No, yeah, I was gonna bring up because I know you brought up, David, about being the oldest of the family, because I am. Are y'all also the oldest sibling? Yeah.
The older.
So I know we can feel this pain. I don't know if any of our listeners or viewers can also feel this pain, but you know, I'm personally the oldest sibling and the oldest cousin as well of my family. And so my family members, my aunts and uncles depend on me. So it's not just my parents, it's also my aunts and uncles. And I'm also always just helping them out with stuff. And like, I don't know, like I love helping them out, but then it comes to a point where I'm just like, I have school and I also have UVSA-Midwest stuff and AAA and VSA and all this other stuff. And I want to do and be great in bigger things in other areas. But just having, like you said, David, having to feel that burden of always having to be there for our family members is hard.
Yeah, no, definitely agree. And definitely agree with Mon, what you said about, you know, not just having your parents or your family rely on you, but like, you know, having aunts, uncles. I'm the old, again, also like you, Molly, the oldest cousin on my mom's side of the family. And then I'm the oldest college graduate, I guess, from my dad's side of the family. So I have both of those to talk about. One, I think like the good thing that you brought up, filial, I can't pronounce it, filial death. It's such a hard word to pronounce, but I think it's a really good thing you brought up just because like it's not something that you talk about as much because like, you know, I don't even know the definition, but I can understand it immediately just because like, you know, we've gone through our whole lives about, you know, family expectations and ways to both meet, but also know when you cannot meet these family expectations. And I think it's not just in our community, so in other BIPOC communities where filial death, but also like all the other themes about mental health that we've touched upon that can be found in these other communities too. And I think the main thing is, you know, overall BIPOC communities are just underserved in many areas of society. And one of them is healthcare. It's like honestly one of the biggest like flaws of like of my system, of my healthcare system. And one thing I'm trying to correct. I know I can't do it by myself, but I've been trying to do it like piece by piece, day after day, trying to make sure that, you know, I don't contribute to these healthcare disparities in society. But, you know, the health disparities within communities that are underserved, and specifically mental health is a big one. And, you know, reasons for these aren't just lack of resources available to the underserved communities, but, you know, the stigma of seeking mental health can play a role in, you know, people not going to the, you know, doctor to seek help for mental health, just because if people see it as weakness and they won't want to go for it. But yeah, I know we talked about meeting expectations and how seeking mental health can be a sign of weakness or not meeting expectations in APIDA communities, but seeking help can be stigmatized in communities also because resilience and perseverance are central themes in their community. So, you know, seeking help can be taboo, or yes, yeah, quote unquote taboo in these communities. And another thing to talk about, which you know, relates pretty well, honestly, with our discussion previously about mental health and culture, is that racism and discrimination impact mental health so much. Like, you know, as humans, we yearn to feel included and be a part of society as a basic and essential necessity. So when, you know, someone discriminates against you based on your race or ethnicity or just something that makes you different, then, you know, you don't feel safe at all or a part of your society. And that can have, you know, just damaging effects on your overall well-being, but especially on your mental well-being.
You know, very good points. I think, you know, as we're focusing on like the APIDA community, like our mental health, it's very important to understand the fact that, you know, this is happening not just for us, but for everybody. You know, I was in a panel last week about self-care, and like I was among other folks in the BIPOC community, and like we all agree that this is an issue not just for like our own communities, but for everybody. But yeah, very good points. And, you know, definitely I want to say that, like, you know, for those that may not identify as a PIDA in like our viewers and listeners, is that together as a collective, we will be able to find resources for each other. And there are resources out there. And, you know, like it just takes that one step into going for it. Like Molly said, is that like she was so glad to be able to get counseling, and that's a great thing. But the thing is like it took that first step, and like it's that positive risk taking that you have to take. As like it doesn't mean that you're weak, but it's just understanding yourself more and knowing what you are valued at. So I bring that into sense. But with that all in mind, I want to talk about some resources, because these are a lot of things that we're talking about. And so it's kind of like questioning, it's like, how can I get help? What are my first steps? So I want to say that like we have a couple of resources. One, for your university students out there, there is something called the Student Health and Wellness Program. These should be kind of pretty uniform across the board. They're also known as CAPS. If you're at different schools, they may be called other things, but they're mainly counseling and psychiatric and psychological services. For University of Nebraska-Lincoln and Michigan State University specifically, we do call them CAPS, and they're pretty much resources where you can kind of get professional help from the university itself, and it also sometimes can be confidential or also at free of cost. So definitely look into those. And they also have responders that are really keen on like the whole COVID-19 situation, where like, you're going through COVID, you're coming out of it, now what? It's like, how do you take care of yourself? But if you can't get like a counselor or therapist at your school, I would definitely recommend going to this website, and I'll spell it out for you, but it's www.psychologytoday.com/us. And in order for you to go on the website, pretty much is that you are able to find one that takes your own personal insurance or your Medicare and such forth like that. And kind of understanding like find people or doctors that understand like your ethnicity, your situation, your community identification. And it also can help things with like explaining trauma and gender inclusive activities and such forth. Also it can range from the price, but the thing is that if it's for the sake of your own mental health, it's important that you invest in your own safety and your health and self-care as well. Not everything is free, unfortunately. And then there's also 3 more other things. So King talked about Headspace app. So it's a meditation app to help you de-stress. I would definitely look into it. It sounds like King was kind of promoting it earlier. So look on the app, Headspace, head and then space as is, pretty self-explanatory. There's also 2 other online ones. There's another one called Talkspace. It's an online therapy platform on the web. And also BetterHelp, which is also another online therapy places. Our CoSR cohort actually formulated all these resources this time. And I think they're very, very insightful. And I've actually been looking forward to using some of them sometime whenever I need them. Or, maybe viewers and listeners can tell me how they are. But yeah, that's pretty much all we have. So, getting towards the more lighter topics right here, we want to bring it back to our always traditional thing, which is our kudos and final questions, if we have any. So Molly, do we have any coming up today? What's our kudos?
Yeah, we have 2 kudos. Our first one is for some of the members from Illinois VSA, and the person who submitted it says, thank you for coming out to Indiana and supporting the VSA Mid-Autumn Festival. So shout out to Illinois VSA.
Yeah.
And then the next one is for all the new VO1 directors. And this is for stepping out of your comfort zone and up to the plate to help plan VO1, because that is a really big conference. I can attest to that.
Wow, so not me and King being on VO1, it is quite a shout out. But we would love to see you all on staff as always. We're very chill, as you have noticed, or maybe we don't bite. I promise I don't. But King, I don't know. I'm a little scared of King sometimes.
I'm a guy. But yeah, because like David said, apply for staff and hope to see some of y'all at VO1 in Chicago. Can't wait. But yeah, before we end our episode, I want to give a quick shout out to the rest of the co-stars who couldn't make it to record. Just want to thank Jennifer for helping us gather these resources, Maya and Richie for helping formulating our topics, and also James and Ethan for their support throughout this episode and past ones. Also, a quick shout out to Linda for keeping us, being the glue that keeps us all together. But yeah, thanks everyone for tuning in to episode 6 of Let's CoStaRt Conversation. Hopefully y'all vibe with us as we talked about something that, doesn't really get much recognition, but is extremely important in all of our lives. But yeah, in the next episode, we'll be doing another informal episode. Cohort will chill and vibe, just like how we did in episode 5. But yeah, Until then, have a great rest of your October.
Happy Halloween, everybody.
See you guys.
See you next time.